So what's costing more money?
More staffing. I'd ask one of them to kind of maybe.
Well, the cost of doing the practice or running the business of medical office, the salaries of our employees have gone up. Our malpractice insurance rates have gone up. The rent that we pay for our office building has gone up. All the fees that we pay, we have to maintain license and we have to pay dues to the societies, they've all gone up. And the cost of the supplies have gone up. You know, the inflation has gone up by about 25%. And when they decided to introduce the SGR formula, probably with the idea of cutting the cost, they only imposed that on the physicians, not on the hospitals, not on the nursing homes, not on the pharmaceutical industry, not on any other manufacturing, the device manufacturing industry, but only the physicians. And as a result, the physicians are the people who primarily provide care to the patients. If there are no physicians, the hospitals and the nurses cannot provide care to the patients.
Why do you think that the rates haven't increased over the past 10 years for physicians?
For the physicians?
Yeah, why haven't they increased? Do you have, what's your hypothesis?
The Congress has failed to act. There are going to be persistent decrease in the rates, and every year they pass a bill to either not reduce it by 5 or 7%, or just maintain the same level as the year before. And that has a cumulative effect of now requiring 21% cut.
But why haven't physicians increased? If they kept up with the nursing homes and pharmaceutical companies.
We can only get paid from the government.
But why do you think they haven't increased it for physicians?
Why they have not increased it? That's the question we are asking.
We would call it the kick the can strategy down the road. They come back.
Can you go to the mic, please?
Oh, I'm sorry. Yeah. We would call this the kick the can strategy, where they keep extending this year to year. In the last few months, the last almost month to month, where they just extend the SGR formula as it is, rather than address the issue. As you can see by this chart, the longer they wait to fully address this funding formula, the more expensive it is for Congress to fix. So those are the big issues, is that every year we get to the brink of this 21.5% cut, and then they kick the can down the road for an additional period of time so that they don't have to deal with that.
Is there legislation out there to provide funding to prevent these cuts? What's the status of that?
As a matter of fact, there was a bill that was passed in the House to get away with the SGR formula and introduce a different methodology of deciding how the reimbursement would be done, but that did not pass in the Senate, and that just happened about 3 months ago. So the Congress still has, we were hoping that when the new healthcare reform bill is passed, that repealing the SGR formula would be a part of that bill, but unfortunately, that did not happen.
What about Senator Coburn's Patient's Choice Act? How does the association have a stance on that legislation?
We don't know all the details of that, so I cannot address everything. Senator Coburn, is one of our physician members of the State Medical Society, and we will hope that he will support us in this issue.
Was there any talk with Senator Coburn about this situation?
Many a times.
So what's his response?
Well, he always feels like he does not want Congress to increase any spending, and that's why he is not fully supported this issue.
Are you concerned that more patients may go, if they can't go get, Medicare patients can't get treatment from doctors, will they go to emergency rooms, do you think, if they get, is that, we've heard a lot about the rising
That
cost of
is
emergency.
exactly what is going to happen. And what happens is, if they go to the physician's office, the cost to the government may be $50 or $60. If they go to emergency room for the same problem, the cost may be $1,500 or $1,600. So it's going to result into significant increase in the cost for the federal government.
Other questions?
Where would these petitions be at for people to sign?
Well, we have a link on our website, we have a link on the Oklahoma State Medical Association website. It requires a click, it requires about a minute and a half for somebody that wants to be part of the petition initiative to enter their information, and we'll collect all of those signatures and make those available to our congressional delegation.
It's an electronic petition.
It's an electronic petition, although we, as you can see, we have the ability to produce them by hand and distribute those too. So.
$1 million seems kind of low. Why not aim higher?
Well, we have a compressed time frame, as you may know. This SGR 21.5% cut goes into effect June 1st. So our effort is over the next month to do everything we can to collect at least 1 million signatures to try and stop that June 1st 21.5% cut.
Is it March 1st or June 1st?
Well, it was March 1st, and it was kicked back to April, and now it's June. As I said, it's kind of a kick-the-can strategy they seem to have adopted to keep kicking it down the road so they don't have to deal with it. So we've just decided it's time to really engage our patients and get them involved in this effort.
Well, why can't doctors ask, it says on your form, I cannot collect your signature on petition due to government regulations. What regulations? And
Well, we want to be careful not to do anything that might look like a violation of our HIPAA laws, the patient privacy laws. So in a clinical setting, we've asked the doctors not to collect that information.
so there's no real government regulations that you can't do that. You're just.
We just want to err on the side of making sure that we don't do anything that might potentially be a violation.
And when's the deadline for people to sign?
Well, we said June 1st. We hope to collect as many signatures as we can by May 15th. We'll continue to collect signatures through the month of May. The nice thing about doing it electronically is we're collecting it in a central database, and we'll be able to make all of those petitioners available to our congressional delegation at the end of May.
Was it 1 million signatures just in Oklahoma or around here?
Around the country. This effort's going on all over the country.
You have a goal for Oklahoma?
You guys want to come up with a goal real quick? Let's
Since we don't know the exact number of Medicare patients that are there in Oklahoma, it's difficult to set a goal. You know, the total population of the state is a little over 3 million, probably 3.25 million. And probably about 300 or 400,000 maybe the Medicare recipients. So
We don't have an accurate number of Medicare?
We don't know the exact number.
But wouldn't you
One-
also say that, I mean, obviously you're not just trying to reach out to Medicare patients, there's family members.
Absolutely.
I mean, so there's probably not anybody in the state who doesn't know somebody.
Well, and military families too.
Yes.
Yeah.
But primarily it will affect the patients, and this is about the access to health care for the patient, Medicare patients. That is what we are concerned about. Because many physicians, you know, as the physicians graduate and come out into practice, most of them have about $150,000 or $180,000 worth of debt they have to repay. Plus they have to live their own life, and then they have to manage the cost of the running the office. And if they reach a point where if it's going to cost them more money to take care of the patient than what they're getting paid for, then it doesn't make sense for them to keep seeing the patients, so they keep on losing money on that. And this 21% reduction in the Medicare reimbursement will reach that point, and many physicians will probably stop taking care of Medicare patients.
Thank you all.
Thank you.